Hello all, welcome to another little video on some therapeutic movement that can be helpful for low back pain, whether it's for an acute injury or chronic pain, whether it comes from arthritis or disc herniation. This can all be helpful. So you'll need a few things to get started. You can have a yoga mat or folded towel, carpet. We're going to be using the wall, but I'm going to be using the chair as a demonstration, but you can get a clear space next to a wall would be great. And then a yoga block and a folded blanket or a towel, something just a little bit softer that you can modify the height of to match what your needs are, more importantly. So very easily we're going to come down onto the floor and onto your back. And you'll be about a half foot from the wall at the most. A lot of the time with this posture, so it's legs up the wall. A lot of times with this posture, people try to get their bum as close to the wall as possible. I find though that doesn't allow for enough decompression of the low back and then causes too much tension in the hamstring. So if you come off just a little bit, it can be a little bit more therapeutic in that way. So come on down, lay on your back. So if you can imagine, again, like I said, for the purpose of this video, just imagine that the back of the chair is a wall, but you definitely want to be against a wall so that the chair doesn't fall away from you. But you'll bring one leg up and the other. Okay, I'll show you a few modifications throughout the video. So you can just hang out here. This is pretty standard, legs up the wall, but I'm going to give you a few modifications to help really decompress the low back. All right? So you can bring your legs down, find your prop. So if you are using a block, you want to keep it on the lowest setting this way. And if you're using a towel, you can play with the height, okay? I personally prefer to use a towel or a blanket just because it's a lot softer, especially if I'm pretty sore, okay? So the block or the towel is going to go just so that the top of it comes to the top of your sacrum, okay? So you're not going to have it come up into the low back here that would be too high. You really want to make sure that it is down behind your pelvis at the base of the sacrum. So once here, you can bring your legs back up the wall and you just rest here. So what you should feel is nothing too huge, but just a subtle decompression of the low back in through here. You may need to shimmy your shoulders up and away from your hips and you'll feel that gentle decompression, okay? If you want to get a little bit deeper, you can bring your feet flat on the wall. Do not do this on a chair because the chair will go flying. And you're going to gently just push your feet into the wall. So you'll feel this gentle decompression of the low back by activating the lower body, okay? So you can try to take a nice breath in, and then exhale, press. Inhale here, and exhale, press. You don't have to stay pressing. You can, once you do that a few times, you can just let your legs rest. You can bring them back up the wall, but if you have a lot of hamstring tension, this might be a little bit too much for you, so feel free to bend the knees as much as you need. Okay, you can sit there for about a minute. Modification. So if this is too much and it's causing pain or discomfort anywhere, I will show you how you can use the chair instead. So whenever you come out of the posture, if you have a prop, just go ahead and ground your feet, lift your hips, and come on back down. So if instead you want to use your chair, or you can use the seat of your couch as well, you can come on down. Just get as much support under your calves as you can. My legs are a little bit short, so I need to shimmy in a little bit closer. And then you're just resting here, okay? Again, you can use a prop under the sacrum or not, and just breathe. Again, if your legs are up the wall straight, or even here, you might notice that your legs get a little bit pins in the air, numb. That's okay, just as long as it's not increasing your pain, that's fine. Just be careful as you come up, okay? So when you come back down, just rolling, you can wiggle your hips side to side if you need. You can do a few little, almost cat and cows, and through your low back here. Maybe some leg windshield wipers, right, left, whatever you need to do to help get things a little bit more mobile after staying there for a little bit of time, okay? So try that, go gently, don't let the pain increase too much, but you shouldn't be afraid of the pain. If you're a little bit more acute, then you definitely want to listen to your pain a little bit more, okay? Have a lovely day, and let me know how it goes.